First, in the U.S. coronavirus outbreak right here in Sacramento, the country's first case of unknown origin now being treated at UC Davis Medical Center. The patient lives in Solano County and has been receiving treatment at UC Davis Medical Center for the last week.
CBS 13's Rachel Wolf is live at the hospital where some employees are being sent home. Rachel?
CBS 13 obtained this internal memo to staff about the first confirmed coronavirus infection from an unknown source in the community. In this, the alarming fact that this patient was here for at least 4 days without ever being tested. Word that a patient with the coronavirus was being treated at UC Davis Med Center was alarming enough. Add to it that the individual had no known exposure to the virus through travel or close contact with an infected individual, and that's cause for concern, says Dr. Dean Blumberg.
What this changes is that screening for travel is probably not enough anymore, is it? Because we know that there's community transmission.
Blumberg is chief of pediatric infectious diseases at UC Davis Children's Hospital. He's worried about widespread transmission because if nobody has been exposed to this new virus,
that means we are all susceptible to it. And that means if we do get a significant exposure, we will get infected.
CBS 13 obtained an internal memo to staff at UC Med Center that says the patient arrived from another Northern California hospital a week ago, intubated and on a ventilator, but was not under strict coronavirus protocols. UC Davis officials questioned health officials as to whether it was the coronavirus, saying we requested coronavirus testing by the CDC. Since the patient did not fit the existing CDC criteria for coronavirus, a test was not immediately administered. On Sunday, the CDC finally ordered the patient tested for coronavirus and put the patient into a special isolation room and under strict contact precautions. Today, the test came back positive, putting Northern California at the center of a potential outbreak.
We only have this one confirmed case of community transmission, but it suggests that we don't know where they got it from. So the person who exposed them probably exposed others. So there's probably other cases out there in the community that we don't know about.
And Blumberg worries we are not prepared.
We would like to have more widespread testing so that we know where this virus is, who's sick and who's at risk.
Because early detection will be the key to stopping widespread transmission. So several of those employees that came in close contact with that patient are being told to isolate or, I guess, if you will, quarantine at home. Other things to remember, Blumberg is saying if you feel that you have symptoms of this, that you need to first call the hospital or the urgent care facility, wherever you're going to go. Now, in terms of the Sacramento County Department of Public Health and the City of Sacramento, I contacted both of those groups today. They have been meeting all day today. They are doing contact tracing, a contact tracing investigation, and we are told that they are going to be making a public statement tomorrow about midday.
Still so many questions, but you certainly understand the heightened alert.
Yes.
Rachel, thanks so much for that live report. This new case brings the total number of U.S. cases to 60. That number includes 42 Americans who tested positive on that cruise ship in Japan. Now, globally, there are now more than 82,000 cases confirmed and more than 2,700 deaths.